Good afternoon. I'm Dr. Jazz Atwal. I'm the Acting Deputy Chief Provincial Public Health Officer. Today I'm joined by Dr. Reimer, our COVID-19 immunization lead. Today we are announcing 15 additional deaths due to COVID-19. 9 from the Winnipeg Health Region, 2 from the Interlake Eastern Health Region, 3 from Southern Health Santé Sud Region, and 1 from the Northern Health Region. I want to extend my condolences to the families, friends, and caregivers of these individuals announced today. The current 5-day COVID-19 test positivity rate is 10.4% provincially and 10.2% in Winnipeg. As of 9:30 a.m. this morning, we are going to have 201 new cases of the virus have been identified and will be announced today. The total number of lab-confirmed cases in Manitoba is 23,381. I'd like to remind Manitobans that contact tracing calls may come from local 204 numbers, or from a 1888 number, or a 1855 phone number. This is because we have partners such as Statistics Canada, Red Cross, and others helping us do contact tracing, and because we use automated calling as well. Please be sure to pay particular attention to your phone calls, even if they are from a different area code. It could be us calling with important information about your health. I would also like to remind all Manitobans of the importance of early case and contact identification and isolation. Our numbers have started to come down, but when people don't answer their phones, that means people who have been identified as close contacts and exposed to COVID-19 who could become positive and transmit the virus to others before symptoms develop are not isolated. This can keep the transmission of the virus going. If we effectively identify and isolate close contacts, that stops the virus transmission because that person should have no additional contacts. People have been asking why public health keeps repeating the same message to stay at home. It's simple. We do this to protect people. COVID-19 affects all of our lives, but it is seriously affects those who are vulnerable. For many of us, we don't have to look too far to find someone at risk for severe outcomes from the virus. For myself, I could look at my family in Manitoba. Many of my family members would likely be okay, but my mom, she's elderly, she's got some lung issues. My 90-year-old grandfather is high risk because of his age and some underlying health issues. Some of my aunts and uncles are just 10 years older than I am, but they have diabetes, high blood pressure. That increases their risk. We know our families, so it's easy to see who is at risk. But I can also think of people in my community that I want to be sure to protect. Neighbors, community members. I know people near me and my age who live in multi-generational homes with 6 people living in it. 2 older grandparents who are vibrant. With them, there's a tween who has a heart problem. Others have survived cancer. Others have autoimmune disorders. I got some friends who were born with a bad heart. These people all have young families. We need to protect them. Looking at all these people, walking by them in the street, you have no idea that they could be at higher risk for an adverse outcome from COVID-19. Young, healthy people can also have significant issues, and I personally know of several healthcare providers under the age of 40 who have had a real tough time recovering from their COVID infection. The virus is harmful. It could harm your family, it could harm your friends, and it is harming your communities. So I say it again, and I'll say it as much as I need to. Stay home. Go for testing if experiencing COVID-19 symptoms, no matter how mild, and self-isolate immediately. Only go out for essentials and only send out one person. This holiday season will be a make or break in our COVID outlook for 2021. I'd like to wish everyone a happy, healthy holiday season, but as I've said before, don't let holiday celebrations bring risk or harm to anyone. I'm now going to turn it over to Dr. Reimer to speak about vaccines.
Thank you, Dr. Atwal. Good afternoon, everyone. I'm Dr. Reimer. I am the province's medical lead on COVID-19 immunization. Yesterday, we immunized 495 people against COVID-19, and a total of 1,687 since the vaccine arrived in Manitoba earlier this month. Another immunization clinic for eligible healthcare providers is running next week, and the phone line is currently open for people to call and book appointments. So far, there have been no adverse events related to immunization reported to us. We know that the vaccine is still in relatively short supply here in Manitoba and across the country and truly across the world. Supplies are expected for the next few months to remain limited. But it is important for the province and for Manitobans to know how we will be prioritizing who gets the vaccine as it becomes available. And while eventually there will be enough vaccine for every Manitoban who wants to get it, we need to carefully consider right now how we manage these limited supplies until more are available. We have an immunization clinic scheduled next week. Based on the limited supply, our criteria are not going to be changing very much for who will be eligible for the vaccine next week. Looking into the new year, we will be progressively immunizing a broader range of healthcare workers, residents of personal care homes, and elderly Manitobans. As the vaccine supplies allow, our eligibility criteria will expand to include healthcare workers who have direct contact with clients, patients, or COVID-19 specimens in the following settings: labs with COVID-19 specimens, child and family services or community living disability services group homes, paramedic and specialty medical transport teams, emergency placement, family violence and homeless shelters, correctional facilities, and home care. Supply is still going to be a limiting factor at this stage and throughout all of these groups. We will not be able to open the doors to every group at the same time. Some healthcare workers, including those working in critical care, will continue to be at the front of the line. Within these groups, we also expect to be setting eligibility criteria by age brackets. Once additional vaccine supplies arrive, beginning in January, another 15,000 Manitobans living in personal care homes who are at most risk of the serious and potentially life-threatening illness will also become a priority group. Again, we have to look at where that vaccine should go first, even amongst this group. To assess the risk and the priority for immunization, we are looking at the number of residents in a facility, as well as the use of shared rooms, where infection is more likely to spread. During the month of January, Manitoba expects enough vaccine to provide approximately 10,000 immunizations per week. Supply is not the only issue. We also have to be able to transport the vaccine to personal care homes and to all other sites as part of our rollout plan. The approval of the Moderna vaccine today is a positive step in that direction. And it is possible that we may be allowed to move Pfizer vaccine from its initial delivery point in the future. Once larger supplies of vaccines are available to Manitoba, we can then expand to add seniors as a priority group, starting with the oldest Manitobans. This recognizes the increased risk of serious outcomes for our elderly. However, based on projected deliveries of vaccine to Manitoba, this may not begin for several months. This is the start of a months-long campaign. And as Dr. Atwal and Dr. Rusin have said, the vaccine will help us turn the corner against COVID-19, but it cannot replace the public health fundamentals that we all need to follow to slow the spread of the virus. So while we are excited to be talking about the vaccine today, that does not change the message of staying home. Thank you, and we will now open it up to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question to start. Up first this afternoon from CBC Radio Canada, Laisa.
Hi, my question will be about the vaccine. I want to know, with the approval of the Moderna vaccine, do we know exactly how many Manitoba are going to receive, and actually how many are going to go for our First Nations community?
So I don't have the exact numbers that I can share today. What I can say is, it's an exciting step that we've heard that Moderna was approved today at the federal level. And so our team is working very hard to work on the logistics to figure out how many doses we're going to be getting and where those need to be prioritized.
And also, you have been talking about like extending the characteristic of receiving the vaccine. Do we know when the First Nation going to start receiving the vaccine in the province?
So we've set up a trilateral table where we are meeting with some representatives from the First Nations communities, and we're going to continue to meet with them weekly to make sure that we are appropriately prioritizing First Nations populations throughout the province.
From CBC Manitoba, Bart.
Hi there, Dr. Reimer. So if I heard you correctly, 15,000 personal care home residents are the next category. What is the target for the month of January in terms of total vaccinations of more healthcare workers and personal care home workers?
So the number, the closest estimate that we have today would be that we are planning to provide 10,000 doses of vaccine per week in January. But those numbers do change on a day-by-day basis as we get updates from the manufacturer and from the federal government. So the best I can do is provide you with that estimate today.
Okay, so about 40,000 a month. Am I to understand then the second category? I mean, the first four categories are healthcare workers. It appears today that you've broadened healthcare workers out a little bit by including the corrections workers and a few other people. Are you still sticking with the other three categories as a priority group? First Nations, adults at risk at First Nations, people in personal care homes, and anyone aged 80 and over. Are those still the first four priority groups?
That's a great question. Thanks for the opportunity to clarify. So we are prioritizing healthcare workers, but that doesn't mean that we're going to do all of the categories of healthcare workers before beginning on other priority groups. So some of these groups may be offered vaccine concurrently. Right now, while we can't move the product, we are focusing on healthcare workers that are the highest priority. But we will be working to expand both to the future categories of healthcare workers and potentially concurrently to residents in personal care homes and First Nations populations in the new year.
From CTV Winnipeg, Josh.
Good afternoon, Dr. Reimer, Josh Crabb from CTV Winnipeg. I'm just wondering if you can elaborate at all on the super site designated for Thompson opening February 1st. Do we know yet if people living in northern and remote Indigenous communities will be receiving the Moderna vaccine prior to that center opening, or is that sort of going to be the first opportunity for people in the north?
Yeah, I don't have that level of detail available today. The teams are working very hard to get that site up and running in Thompson, but that doesn't close the door on any other options should they become available, and it really is dependent on when we get doses and which product we have available.
Thank you for that. And a question for Dr. Atwal. Yesterday, there were 7 deaths reported at Oakview Place Personal Care Home. We're hearing from the care home there are actually more than that. Just wondering if you have any information on the number of people infected and the discrepancy between what the care home is reporting and the numbers from the province.
I don't have details on that. I mean, that's something we can get. I mean, I had the number of deaths that was posted yesterday. I have the number of deaths posted today, but that's something we could clarify. I mean, sometimes it's just a timing of when information comes out that there could be a bit of a discrepancy as well, but that's something we could look at getting to you.
From City News, Jonas.
Good afternoon, folks. Dr. Atwal, first one for you today, if you don't mind. It does seem as if the hospitalization ICU numbers are down, but do you have the non-infectious numbers as well to compare?
Sure. Yeah, on the hospitalization side, there's 259 active cases, plus another 100 that's recovered for a total of 359. In the ICU, there's 37 active COVID infections, and there's also 7 that have recovered in the ICU for a total of 44. And there's also 30 ventilated patients who have COVID-19 and 6 who have recovered as well for a total of 36.
Thank you very much for that, sir. Over the last couple, this week, it does seem things are progressing. As far as the outflow out of the ICU, admissions into hospital, just a statement, I guess, on where the hospital situation is right now heading into Christmas.
Well, I mean, we've talked about this before, right? That exponential rise isn't there. We see that plateau now. We still need to see those numbers come down. When we're dealing with the acute care system, there was capacity issues. There still are capacity issues. The hospitalizations, always trail our daily case numbers by 7 to 14 days as well. So we still have a ways to go to get our hospitalization numbers down. Our case numbers still need to come down as well. Again, we need to focus on, maximizing our opportunity to have a good 2021. We need those case numbers down on a sustained basis, and then follow suit with that. Those hospitalization numbers come down, and it would put us in a much better place to be able to look to the future, to be able to manage COVID-19 from an acute care perspective.
From CHVN, Taylor.
Hi, good afternoon. We're hearing just anecdotally, some people think that the gathering size restrictions in Manitoba have loosened, but can I just get you to clarify again what exactly is allowed for gatherings and Christmas gatherings?
Yeah, basically our message is stay at home, right? We're not promoting gatherings. You're not supposed to have people over at your home, right? There's no parties and there's no dinners, etc. You want to stick to your household. That's at your residence. So it's very black and white. Stay at home.
Great, thanks. And when it comes to gathering outside, there's that 5-person group size. Can you explain a little bit more about what that could look like for someone if 5 people on Christmas can go for a walk or things like that?
Yeah, so in public spaces, there's group sizes of 5. Right, so you can go into a public space with 4 other individuals. You still want to physically distance if you're not from the same household. If you are from the same household, you can be together. Again, it's good to go out. It's good to get some exercise. It's good to have some recreation. It's good to get some sun. But you still want to try to restrict it to your household if you can. Right, and essentially outside of exercising or enjoying the outdoors for a period of time, you want to be at home. You want to stay at home.
From the Winnipeg Free Press, Katie.
Good afternoon. I had a question about the self-isolation requirements for travelers. We're seeing now that Alberta has the highest COVID-19 case counts per capita. Will you be reinstating self-isolation requirements for people traveling to Manitoba from the Western provinces?
Good question. We're always looking at the epidemiology. We sort of talked about Manitoba's cases that are travel related. That number is really, really low. There's risk all around. We aren't promoting traveling. We are telling people to stay at home. But that's something that we do look at on a regular basis. And that opportunity does exist. And we'll be looking at that information over the next week or two to determine what else needs to get done to protect Manitobans.
Okay. And just to follow up on a question that Josh asked, we are seeing some of the highest numbers of daily deaths in Manitoba over the past couple of days. Many of them are personal care home residents, but we are noticing that lag time between when the care homes are reporting the deaths and when that data is released by the province. So do you have any sense of what is causing that delay?
I don't have a sense. I think sometimes it's about verification. We want to verify the deaths. We want to make sure on that. Again, that's something we could take back and look into and provide a response.
From Global, Joe.
Hi there. My first question, I'm wondering about where Manitoba is at right now in talks with the federal government about other potential vaccines that might be approved.
We right now have really been focusing on the mRNA, so that's the Pfizer and the Moderna products, because those are the ones that have been approved by Health Canada. There are ongoing analyses for a variety of different vaccines. Certainly some of them are showing a lot of promise. I don't expect that any of them will be approved in the immediate future in the next few weeks. So we do want to try to use what is available to us the best way possible to immunize as many Manitobans as possible with the two products that we have.
Okay, thank you. And my second question is about frontline healthcare workers and Manitobans in general who might be having a hard time this time of year, and if there are any supports available to people who are having a hard time.
There's resources available. There's resources available online. People could access, frontline workers have unions that they could access through, or organizations as well. There's resources available through Manitoba's government website as well. So those resources are available. I think a lot of frontline workers also have friendships with others within healthcare as well, and we always encourage individuals to connect, virtually or by phone, to make sure that they remain connected and are able to support each other as well.
From the Brandon Sun, Michelle.
Hello, good afternoon. I'm wondering, will Brandon be receiving both vaccines, the Moderna and the Pfizer? And aside from storage temperature, is there a difference between the two? And do you have a timeline now for the vaccine arriving to the city?
Okay, the first question, we don't yet know exactly which sites will be receiving which vaccine. As it stands, Pfizer still has the most limitations about how the product can be transported. Moderna is a little bit more relaxed or lenient about how we can transport it. That said, they also have very stringent transportation requirements that we need to meet. So as we're working with the manufacturers and the federal government, we will determine what's the safest way to move the product to reach the most number of Manitobans, but I can't give you a direct answer today about which products will be available in Brandon. Could you repeat the second and third questions?
Hello?
Can hear you.
Sorry, I can't hear anything.
Did you hear my response to the first question, or would you like me to say it again?
Oh, I was just wondering about a timeline, I guess, for the city.
So right now we are on track to start the convention center clinic on January the 4th, and the plan right now for the Keystone Center in Brandon is January the 18th. Keeping in mind that, like I've said, these numbers that we get from the federal government do change regularly, but so far it looks like things will be in place for those two dates.
Great. Also, I was wondering if you had info to share about the secondary attack rates and how it might be different in various settings and populations, sort of families, young children, adults versus children, outdoor gatherings, homeless population, that sort of thing. Alberta has shared a document about that, and I'm wondering if Manitoba has something similar.
I don't think we have a formal document on that. I know 16% of our contacts end up becoming cases. We know in homes with lots of individuals or in congregate settings, the attack rate actually is quite higher than that, and in some instances it's hit 80% or even 100% in the home setting. Communities where there's a lot more individuals living closer together or network closer as well, those attack rates are higher. I don't think we have a breakdown specifically via region, via certain populations, but that's something we could see if we can get.
Thank you.
From the Winnipeg Sun, Scott.
Good afternoon to both of you. Just a quick question on, I guess, so it's 10,000 doses a week or 10,000 vaccines a week. Does that include the second vaccination in that? Like, is it all inclusive? Are you setting aside, that would be, in 3 weeks' time, there'd be another 10,000 doses, or you'd have those doses for the people that called them initially?
So the 10,000 per week estimate right now refers to the number of doses that would be available per week. And so that would mean that people would potentially need to come back for a second dose that would be included within the 10,000.
Okay, so that would be 5,000 total vaccinations then?
That is the best estimate I have, but we can go and review that to ensure that that is accurate and get back to you.
Okay, thanks. And just if I can get the follow-up, the travel restrictions thing, I mean, we're still seeing it. I guess I'm trying to understand, Dr. Atwal, how, like, I know you're looking at it, but what is there to look at when the epidemiology out west is worse than it is out east, I suppose?
Right. I mean, so I think we've alluded to this and talked about this on a number of different occasions as well. I mean, the epidemiology changes, right? Our numbers are really high just a few weeks ago. Now they're getting lower. In the past we had low numbers, other provinces had high numbers. So numbers do fluctuate. I think we have to look at the risk of acquisition and understand that and understand the epidemiology of cases that are travel related and then determine what the next steps would be. There's a lot of important individuals or businesses and food, supply chains, et cetera, that rely on the ability to move across borders, right? So we need to take that into account as well. But again, we are looking at this on a regular basis. It's not just one indicator again. We never look at one indicator when we're looking at restrictions or orders. We look at a number of indicators and we look at the impact of what a restriction would mean to the population. So we have to take all those things into account.
From TSN, Sarah.
This question, Dr. Atwal.
We've lost your question, Sarah. Can you repeat, please?
Sorry, apologies for that. Dr. Atwal, just wondering whether or not there's any update on the NHL's request to have the Winnipeg Jets play regular season home games in Winnipeg this season.
Yeah, so we're continuing to work with our partners, our interprovincial partners, right? There's 5 provinces that are impacted by this. There's work done federally as well, and we're engaging with the NHL, and they're engaging with public health as well, and that's ongoing. So that's really all I could say about it right now.
And just as a follow-up, so with that in mind about the interprovincial discussions that are going on, is it unlikely then that the province of Manitoba would make an announcement before decisions had been made with the other 4 provinces? Is that something that you would announce a decision independently, or is it likely that the province would wait?
I think realistically we're working on this as a collective with the other provinces, so I think it would be a collective announcement.
Thank you.
Thank you. We have a bit of time left for a few more questions. Please proceed.
Dr. Reimer, it's Bartley Kivas here at CBC. Just following up on Scott's question, so 10,000 doses a week, that doesn't include the second 10K dose for those same people, or it does? So are we looking at only doing really 5,000 people a week, or are we looking at 10,000 people a week?
So my understanding of the estimate is that we're referring to 10,000 immunization events, so that we would be putting 10,000 needles into arms per week. But as I mentioned before, I will review that with the team to ensure that that is accurate, and we will get back to you.
And a follow-up on that, 260,000 a year then. There are 1.4 million people in Manitoba almost. Is it safe to say you plan to ramp up beyond that 10K then to ensure more people will be vaccinated in 2021?
So the estimates that I was sharing today are referring to January, and we are looking forward to ramping up as soon as vaccine is made available to us. So these are the numbers that we've been provided by the manufacturers and the federal government, but as soon as more product is available, we will be increasing the numbers that we have available for Manitobans.
Hi, this is Michelle from the Brandon Sun. I'm wondering if you have a number on the percentage of cases of COVID-19 in the province that have come from personal care homes specifically.
I don't have that number, and again, that's something we could look at getting.
Thank you.
Hi, it's Katie May at the Free Press. Just some clarification about the estimated 15,000 residents of personal care homes that are expected to be eligible for the vaccine. Are you saying that the province is expecting those 15,000 residents to be vaccinated by the end of January?
Not necessarily. We do know that even within these priority groups that we will need to create some further prioritization because the vaccine is not going to be coming in large chunks at one time. We do need to have a process where as they come in week by week, we continue to expand to include more facilities. So whether or not we're able to achieve the 15,000 all residents within January has not yet been made clear, but we do plan to look at that in the very near future.
Hi, it's Josh Crabb from CTV Winnipeg. Dr. Reimer, Health Canada is expected to roll out more details on logistics and vaccine rollout this afternoon. When do you expect the province might know more about the Moderna vaccine and where it's going, how many doses are coming?
Yeah, that's a great question. The announcement of the approval was just this morning, so we are still awaiting more details from the federal government about exactly what the plan is for rollout. And as soon as we have that information, we will be working on logistics and communicating that to Manitobans once those details are worked out.
Doctor, go ahead, Liza.
Okay, thank you. By January, how many immunization clinics are we going to have in the province?
Are you referring to individual locations or how many vaccines do we believe that we'll be able to provide?
No, location.
Well, the plan right now for rollout is to have 3 main sites where we're providing immunization. But as we get more instructions and clarification on our ability to move the vaccine around, we do plan to take it into places where it's not reasonable to move people to the vaccine, such as personal care homes. So while we are planning for 3 large sites, there will be many smaller sites that move from location to location to meet the people who are of highest priority and where it would not be reasonable to expect them to come to those super sites.
Are the 3 main sites going to be in Winnipeg or out of Winnipeg? We plan to have some out of Winnipeg.
The 3 sites are in Winnipeg, Brandon, and Thompson.
Thank you.
Dr. Atwal, it's Bartley Kevis here. There's not going to be any bulletins, COVID bulletins on Christmas Day and Boxing Day and New Year's Day. Will there be some form of means to get those daily counts those days at all?
It's a good question. We'd have to get back to our communication side and just see what is going to be made available. So again, we'll have to get back to you on that, and an answer to that.
Time for a couple more questions.
Hi, it's Josh Crabb from CTV Winnipeg. Just on the numbers, the 10,000 immunizations expected per week in January, I think that this is taken into consideration both vaccines, Moderna and the Pfizer-BioNTech vaccine. Is there a split, or because some vaccines are better for more remote northern communities? So I was just curious if there's a further breakdown.
Yeah, I don't have an exact breakdown for you today with the 2 products, but the plan certainly is to look into the safest and most effective ways to move the vaccine, and it is likely that the Moderna product will be moving to more remote locations compared to the Pfizer product, but those details are still being developed and the logistics are still being worked out.
And on Dr. Reimer, sorry, just for personal care homes, for the 15,000 residents, would they be getting the Pfizer BioNTech vaccine or the Moderna vaccine? Will it be delivered right to the personal care homes and injected there?
Yeah, the plan for personal care homes would be to bring the vaccine to them. We don't want people who may have multiple health conditions or those who are very elderly to be expected to move to our vaccine clinics. So we will have teams that move to the personal care homes with the vaccine and provide it on site. Regarding which product, right now it's looking most likely that it would be Moderna, but we are working both with the federal government and with the manufacturers to review the transport requirements so that we could potentially move both products in a safe and effective manner. And so if we are able to move Pfizer, that potentially could open it up for those facilities as well.
Dr. Atwal, I'm wondering, Dr. Rusin has spoken about modeling, and he always talks about 4 scenarios, sort of best to worst. What is the worst case scenario in terms of the holidays with public health orders in terms of numbers of cases?
I mean, realistically, there's more than 4 scenarios, right? I mean, if we look at if people listen to the public health guidance, to the messaging, the focus should be on being in a good spot in 2021. We want to limit those interactions. We want people to stay at home, not interact with other individuals. Then your risk of COVID is really low. That has less of an impact on hospitalizations. If people do, get together, if there's large amounts of people doing that, I mean, every person getting together with another person increases that risk. And obviously the model looks bad. And you could have any variation in between those 2 extremes. Again, our message is stay at home. We need to have a real good start to 2021. We need our case numbers to continue to come down. We need our hospitalizations to come down. We need Manitobans to protect themselves, to protect their families, and to protect their communities. And I think that has to be the focus. Don't worry about a model. Worry about protecting yourself, your family, and your community.
This concludes our media briefing. Thank you.